Endometriosis. Endometriosis is the gynecological equivalent of preeclampsia as far as I'm concerned. In other words, I despise them both. Endometriosis is more common than you think. Don't be so quick to write off the diagnosis. Researchers believe that at least 11%, or more than 6.5 million women in the United States between the ages of 15 and 44 are affected by endometriosis. It is especially common in women in their 30s and 40s and may make it harder to get pregnant. Just an FYI, if a woman has primary infertility, i.e. trying to get pregnant with no history of previous pregnancies, endometriosis has to be on your radar. So here are the top 5 facts about endometriosis that I think you need to know. Endometriosis occurs when the cells that line the inside of the uterus, the endometrium, which is normally shed monthly as your menstrual period, get shot out of the fallopian tubes and implants on various aspects of the pelvis, i.e. the tubes, ovaries, cul-de-sac, etc. Endometriosis can also implant on the bowels, appendix, scars. The hallmark symptom of endometriosis is pelvic pain characterized by cyclical, painful periods. The pain associated with endometriosis is oftentimes more severe than your typical period cramps. Endometriosis pain is often described as debilitating. Other symptoms of endometriosis may include abdominal pain, pain during sex, bowel issues such as constipation, diarrhea, most commonly during your period, infertility, painful bowel movements, pain with urination. Pain associated with endometriosis may begin a few days prior to the onset of your menstrual period and/or extend several days into your menstrual cycle. Causes of endometriosis. No one knows for sure what causes endometriosis. There are, however, several theories. A few of the more popular ones include retrograde menstruation, when menstrual blood containing endometrial tissue gets shot out of the fallopian tubes and implants on various aspects of the pelvis. These displaced endometrial cells, in turn, adhere to various aspects of the pelvis, be it other pelvic organs, pelvic walls, or, as previously mentioned, other structures such as bowel, appendix, etc. These cells, in response to hormones released by your ovaries, continue to grow, bleed, and create an inflammatory response, which can cause pain, and eventually scar tissue. The induction theory. This was when peritoneal cells, or cells that typically line the abdomen, are transformed into endometrial cells by hormones or immune factors. Endometrial cell transport. Endometrial cells are transported to various aspects of the body via blood vessels. Surgical scar implantation. Endometrial cells attached to incisions made at the time of a hysterectomy, C-section, etc. You can further explore these theories in the endometriosis blog on AskDrAngela.com. Risk factors for endometriosis. Although anyone can have endometriosis, some factors increase the likelihood of getting it. Family history is a big one. Specifically, if you have one or more relatives, a mom, aunt, sister, with endometriosis. Short menstrual cycles, i.e. menstrual cycles that are less than 28 days between periods. Early onset periods and heavy menstrual periods lasting longer than 7 days. Alcohol consumption. Yep, drinking alcohol is a risk factor for endometriosis. Any medical condition that prevents the passage of menstrual blood flow out of the body. Imperforate hymen and uterine anomalies immediately come to mind. Endometriosis typically develops several years after menarche or the onset of periods. Diagnosis and treatment of endometriosis. Diagnosing endometriosis involves a thorough history and exam. Make sure you pay close attention to family history, social history, reproductive history, such as the age of menarche, length and heaviness of the menstrual periods, and the signs and symptoms of endometriosis, which we've already mentioned. During the evaluation, a thorough pelvic exam will be done by feeling for large cysts, endometriomas, or scar tissue behind the uterus. An ultrasound might reveal a characteristic finding, such as the previously mentioned endometrioma, which is a cyst that is commonly associated with endometriosis. Endometriomas are also known as chocolate cysts. Other than an endometrioma, endometriosis doesn't really have significant findings on ultrasound. For more information on anything that you've heard in this video, please visit AskDrAngela.com and read the full blog post on endometriosis. Thank you.